Beforehand, I was looking for some resources, like reading some books about how to communicating with patients, and I did read through the textbooks about how to provide care, and I knew and then I read some books about Australian works, like how to maybe some commonly used words that phrases that will be heard quite commonly. For the first clinical for the students in the future, I suggest they would prepare themselves internally to say that I'm going on the clinical placement maybe tomorrow, maybe next week. I have to calm down. I can't panic because panic can't do anything worth for it. So what you have to do is you can ask for advices for the other students for other year or the clinical staff they might know. If not, they might just go on some textbook to look for some clinical skills that you can develop that your first clinical might ask you to be completed, maybe because it's not too complicated. The first clinical is just an experience for them to get familiar with how the hospital works, how a shift works, how different nursing staff or medical staff work each other. Because after the first clinical, you will know more how to prepare for it.
I did something similar with her, but actually I made some special sheet for myself, and I put some my objective for each day, and I think about, because they required we should know about our implement related to the ANMC competency as well. So I just read through the whole things, and I trying to familiar with each different type of competencies. For the first time, I think I should prepare perfectly for everything, but in the hospital, there are a lot of people can support me. I was not alone in there. So maybe I should prepare some other things. Sometimes some other things happen, and I really need to flexible for the situation by myself. And for my first clinical placement, that was speaking Korean is another thing. I didn't expect I'm going to speak Korean in the hospital, but it was quite nice. They can prepare for their first clinical with a lot of knowledge of nursing. They should study hard, but it's not the only thing they can prepare. Maybe there's a lot of situation in the hospital, so maybe they can prepare some study group to imagine about the situation and make a dialogue, and just naturally speaking with each other, like role play, maybe nurse and patient, doctor as well. But and the other thing is because it's a assessment, part of assessment as well. I think we should know about the objective clearly, what we really need to learn about for the first clinical. But for the first clinical placement, it's like a more really general basis. So it's like a measurement of vital signs, or introduce myself to the all people in the hospital. It's really simple, but if you are not really confident about it, it's not really easy to develop in the hospital. So I think like a role play or other prepare their own learning objective can be helpful for them.
My advice to prepare for the clinical is that just to review maybe laboratory workbook, learning guide. It tells you you have to, because by OBS, checking patients' OBS is the most important thing that first year students must able to do. So you have to know the normal ranges of vital signs, because often so many patients ask me, oh, my vital sign, my blood pressure was normal, or it's not normal. You have to be able to say. Also, not knowing the normal ranges is important. Also, what does that mean? Blood pressure means. They don't know what's blood pressure, some patients, so you, in your own words, you have to explain well to the patients in their level, because some patients, the knowledge is not good enough to reach the academic, so you have to use the easy language, easy words to explain them. So in order to do that, you have to study, maybe using textbooks, you have to read a lot, or even ask teachers, lecturer, like what's that mean, and they will be able to, they are able to explain to you, and you just write down. So and just read overview, like, and in maybe fundamental books or medical research in our textbooks, you will be able to see for example, like vital OBS chart, how to record it. And if you're not sure on that day, maybe to RN, you ask them how can I record this, and you will see many pressure sore like chart or something, discharges, so many forms that nurses fill out, and you will see the patient's chart, and then you just go through the chart and see what kind of forms are they, and then of course you have to know the abbreviation. As I said before, you have to ask stuff if you don't know. And yeah, but I think best way, my case actually I didn't expect that on my first day that like so many like nursing staff would ask me to what to do, like take shower. So I wasn't really prepared. But when I went there, through my communication, I talked to that nurse and facilitator. I learned so many things from them rather than actually I checked on it. So if you communicate well and ask, don't be afraid, then you will learn so many things from this experience.
Yeah, you are a first year, so don't be afraid. You are there to learn, not to show something. The staffs don't expect too much of you, so you just show your good attitude to show that you want to learn something and focus on your criteria, your objective. What I want to say was that just prepare for the communication, especially English. You can practice the accent, intonation, and everything by just memorize some sentence and say it loudly 10 times or 15 times a day, the same sentence, but it's really helpful.